And Dr. McGrail told me in no uncertain terms, you're going to be fine. Just do these exercises and you'll be fine. And when he said that, I didn't believe it. Didn't feel like I was going to be fine. Recovery has two aspects. One is recover medically from the injury, which is the physical therapy exercises. Do physical therapy. You're not going to get better by resting or by playing. And the second is you can return to playing while you're doing the exercises, but you must return to playing in a way that is protective against injury. I knew there were two possibilities. My nerves would heal or they won't. So I just said, well, let me just stop playing. Rather than be frustrated or trying to play on with air leaking everywhere and not able to feel what I'm doing. Because if I do that, knowing what I knew about it by that point, I might start to make unconscious adjustments to get through it. And that in and itself can be damaging to our habits. I hear people and I feel their pain and desperation, some cases, panic, depression. I love to be able to tell them, you're gonna be fine. And then to see them come out the other end of it.
Welcome back to the show, everybody. My name is Clark Lovell. I'm your host, and today I wanted to invite somebody who's helped me through my own personal journey with injury, and he has helped hundreds of other trumpet players through their own experiences. And so, without further ado, Brad Goode, welcome to the show.
Thanks, Clark. It's nice to be here with you.
All right. Yeah, thanks for being here and taking the time to hang with us. So I wanted to just start out with you sharing your story with the audience, with podcast land, as I like to call it, with your injury and how, because you have a couple of experiences with it and how you got through it and things like that. So what has been your experience with your injuries on the trumpet?
Yeah, well, I've actually had 3 injuries. The first one happened when I was 15 years old. And I just got my first flugelhorn. My parents bought me a flugelhorn, and I didn't have the little screw that tightens the straight lead pipe tightened enough. And while I was playing around, the tension came loose, and I pulled the horn into my face, and I actually stuck these 2 teeth through my upper lip. They were sticking out of my upper lip. And I went to the emergency room, and I got 4 stitches right here, right where the mouthpiece sits. And then I got the stitches taken out, and I went back to playing. And of course, playing was much more difficult than it had been before. It felt harder, but I was 15 years old. I wasn't thinking at that time about being a professional trumpet player, nor was I thinking about the injury being a detriment. And I just went on and just played. I know that my lip was different and that I had, a lot of scar tissue there. And I'm not exactly sure what I did, but I adjusted somehow and went ahead. Then when I was, I have to figure this out, 38 years old, and I was teaching at the Cincinnati Conservatory of Music, I was practicing with my eyes closed, and I had a very thick soundproof door on my teaching studio, and I was standing near it, and the door was opened into me. And what happened that time was kind of similar, but I didn't put my teeth through my lip. What I did was I actually kind of bit with my lower teeth
Mm.
and stretched my lip down. And then my lip swelled up quite a bit. It looked like I had a marble sitting, inside my lip. It was so
Mm.
swollen. And I went to the emergency room again, hoping that I didn't have a similar kind of injury. And the doctor said, "Well, you look fine. Just go home, and to take the swelling down, every hour ice that for 10 minutes. And after a few days, the swelling could come down." And the doctor didn't tell me, "Don't put the ice directly on your lip." So every day for 2 or 3 days, you know, every hour I'd take an ice cube and put it on there for about 10 minutes. And the swelling went
Mm-hmm.
down. But after I got through that process, I could not play at all. At all. So I couldn't make a buzz. I couldn't make a sound, any sound at all. Not even a peep on a trumpet.
Could you even like form an embouchure?
Yeah, but there no sound would come out.
Okay.
Um,
Interesting.
so I became very depressed, um, and I didn't know what to do about my not only my gigs, but I knew what to do about my gigs. I canceled them. I didn't know what to do about my job, where I was, half my job was being the jazz trumpet professor, and the other part was teaching
Sure.
jazz courses and ensembles, etc. I thought about quitting because I didn't feel good teaching trumpet lessons, not being able to play the trumpet.
Mm-hmm.
And after several months, my wife found out about a doctor in Toronto, Canada, named Simon McGrail. And Dr. McGrail was dealing with lip injuries in brass players. He was a ENT, eye, ear, nose, throat doctor. He was a plastic surgeon, and he himself was a French hornist.
Mm.
So we drove to Toronto. I went to see Dr. McGrail, and he said, "Well, you don't really have a tear in your lip, but there's two problems." He said, your initial injury, you stretched your lip out. You elongated your lip from biting
Oh,
from biting it down. He said,
right.
but that's not as bad as what you did to yourself with the ice, because with the ice you destroyed all the muscle tone in your lip, and basically he said mush is the word he used. He said instead of having muscle there, you'll
Oh.
have mush. And that's why my lips wouldn't vibrate,
Mm.
because there was no muscle tone in my lip. So Dr. McGrail ingeniously was a person not only who believed that he could perform a plastic surgery on people with a condition that he named Satchmo syndrome, which is a tearing of the lip tissue from playing with improper technique, that many brass players suffer. He believed that the best path to recovery from that type of injury was to do a plastic surgery so that the scar tissue in the lip would be the smallest, and then to do physical therapy to recover the strength and integrity of the lip muscle after the surgery. Now, I didn't have a tear, so I didn't need surgery, but my muscle was so much weaker than the patients
Mm-hmm.
who had these playing injuries that I had to do his physical therapy exercises much longer than his playing injury patients, in order to recover strength in my lip. The genius of Dr. McGrail is that the lip is a sphincter muscle, and unlike most muscles and ligaments in our bodies, the lip does not adhere to a bone or joint, so it can't be worked against a bone or joint to be built up.
Mm-hmm.
But Dr. McGrail devised a way to substitute teeth for bone and do reps with the lip against the teeth until the lip muscle had a lactic acid burn and you were actually doing muscle building, like weightlifting exercises with your lip
Weightlifting, yeah.
against your teeth. So I did these exercises for about a year, and while I was doing them, I was starting to play again, but I of course had a much weaker lip than I had had before the injury,
Right.
and this is the second time my lip's been weakened, you know. So during that period when I was coming back playing, I had to really examine the elements of technique and learn to play the trumpet with less strength in my lip. So when I did get something close to full strength back in the lip tissue, albeit my lip is a different shape than it was before that second injury now,
Yeah.
I had really looked at everything. I'd thought about all the lessons I'd had during my life and all the advice I'd had. And I looked at how things worked and how they didn't work. And I saw what worked for me and what didn't work. And it was incredibly eye opening and clarifying for myself about approaches, physical approaches to playing the trumpet. And I came out of that experience not only a more knowledgeable trumpet player and a person who knew something about recovery from lip injuries, but I came out of that experience with better range, better endurance, and better technique than I had ever had in my life. I'm still kind of refining and subscribing to these things I learned during this injury period, which was 2001, 2002. And I'm still getting stronger. My endurance and my range are still increasing. And I'm 60 years old. So the more I learn about it, the more practical application it has in my own musical life. The third injury I had was about 5 years ago now, where I chipped a tooth, and I played on that tooth that was chipped, and I did nerve damage to the left side of my face. And then I lost feeling in kind of this quadrant, this upper left quadrant. And I stopped playing for 3 or 4 months and waited until the nerve ending kind of reconnected and regrew. And I started playing again, and my control and my strength were down. But as the nerve continued to heal while I was playing, I regained all my abilities and my sensation and my feeling. So I've learned a lot of stuff. I've learned that embouchure technique is very important in preventing injury. So knowing how to use good embouchure technique can prevent these things from happening in people who are getting this Satchmo syndrome or any gradation of a muscle injury from playing. And I've learned a lot about that. I've also learned that we play best when we play by feel, and that it's our nerves that give us the feel, not our muscles. So our muscles can't feel
Right.
anything.
Right.
So the nerves play a very important role in brass playing, as they do in any motor activity, you know. So the importance of feel and understanding that, these are the things that I came out of these trials with. Do I wish none of that had ever happened? I don't know, because gosh, I've learned so much, and
That's the thing. That's $1 million question.
yeah, maybe I wouldn't have figured out the answers to a lot of things that were puzzling to me with my playing without having these setbacks, so.
Mm-hmm.
It's, you can't undo the past.
Mm-hmm.
It is what it is. But I consider myself a very fortunate person to be playing the way I'm playing right now, having gone through all these things, and having learned what I learned in these experiences.
Yeah, and I'd say that the rest of us are fortunate that you did too, so we can learn from it, right?
Thank you.
Um, so I I want to kind of explore this period as much as you want to, I guess, dive into it. The period of time when you weren't playing those, I guess it was however long between in your recovery period with the icing injury
Hmm.
and also the I guess the period of time a couple of years ago when you were letting your nerves heal. Because I feel like when people are going through injury, they're not. I mean, I guess part of the hardest part of it for a lot of people is the fact that they can't make the music that they are used to making or that is most meaningful to them. And I know that's definitely been my experience. And I'm just curious if there was anything that you did during that time, whether that was working with your students or just with your own personal musicianship during that off time. What did you do? Kind of just I think of it as staying musically healthy.
Yeah.
Just like keep the music
Well,
alive
I don't think
when you
in
can
the
play.
first period, I don't think I dealt with it too well, to be honest. And I am a bass player. I have a master's degree in bass. But
Oh wow.
but a lot of my opportunities and a lot of the ways in which I identify myself within the musical communities and educational communities I'm a part of, have a lot to do with being a trumpet player. Bass has always been kind of
Hmm.
a hobby for me. And so it was just around the time that I was starting to, pull my head out of this really serious depression, and say to myself, well, this is what it is. I'm not going to play the trumpet anymore. I need to change my head and become more positive and start practicing the bass and become a better bass player. That's about when we found Dr. McGrail. And
Oh cool.
and Dr. McGrail told me in no uncertain terms, you're going to be fine. Just do these exercises and you'll be fine. And when he said that, I didn't believe it. Didn't feel like I was going to be fine. And I'd been really, really in an awful mental state. Just terrible. So I didn't deal with it well. When it happened this last time, I knew there were two possibilities. My nerves would heal or they won't. you know.
Sure.
So I
Hmm.
just said, well, let me just stop playing rather than be frustrated or trying to play on with air leaking everywhere and not able to feel what I'm doing. Because if I do that, knowing what I knew about it by that point, I might start to make unconscious adjustments to get through it, and that in and itself can be damaging to our habits. So let me wait till there's enough
Right.
feeling back where I think I can play pretty well to start practicing again.
Hmm.
And so after I'd pick it up every once in a while, every few weeks. It's like, where is it? Okay, no, it's not too good. And put it away. So, but I did have
Hmm.
more patience, and I had you know things to distract me from it. I know there are people who, and most musicians, I think, would say, I'm music is not who I am, it's what I do. But
Right.
for me, I've never been able to get there. Honestly, I just love music so much that when I get up in the morning, I think about what's going to happen musically today. What am I going to work on musically?
Hmm.
What what's what's coming up, when are the opportunities to play with other people. Am I writing some music? Am I going to listen to some music that I want to understand better? And this is, I kind of structure my day. Of course, teaching music now, that's structured for me
Right,
now.
right.
But the day is structured around being a musician, and I'm okay with that. And if I do get to the point where I can't play trumpet again, that will be okay. I'll still have music. I won't be cut off from music. Music will still be there for
Yeah.
me. So I don't think it's important for myself to identify away from music and to separate who I am from what I love to do most. I know there
Hmm.
are people who say that, but I'm not one of
Right.
them.
Well, I've been going through the same, I guess, identity discovery
Hmm.
myself, and I think what I realize is the reason why there's that kind of like disconnect with, like when you're not able to do what you're normally used to doing on your own instrument. What I've noticed is that the reason why, at least for me, is because that's my chosen form of expression. I don't necessarily like to, I mean, people express themselves in different ways,
Hmm.
whether it's through their vocation and other things, or writing or what have
Right.
you. And when I was going through the beginning stages of my injury, um, I realized that the most personal form of expression, right, how I express myself, was no longer there. And that's kind of like, um, it was kind of for me, like this is why I do what I do. So it was kind of a self discovery moment. And I think all of us, in order to go through what we put ourselves through as musicians to get, proficient in our craft, that's kind of the conclusion that we have to come to, is like why we're doing what we're doing. And I would say even more importantly, for people who are going through injury, and recovering from it, that's critical, because on one hand, they could discover that what they are doing in music is critical for their development and for what they want to be doing with their life. And for others, they may discover that it's just another chapter. And so I feel like that discovering of why, like what with you discovering that it's still so much a part of you,
Hmm.
that I think every musician needs to come to that, basically come to that conclusion,
Or
regardless of what that conclusion may be.
yeah, or not, or maybe discover it's not
Hmm.
that essential to your life.
Right.
Um, if I can't play trumpet again, I'll play the bass. If you tell me I can't play the bass anymore, I'll just start writing more music. I know
Yeah.
that I
Yeah.
want to
It's.
be a musician. And nothing is given. Tomorrow's not given to any of us. Anything could happen
Hmm.
anytime. And it's certainly with the trumpet. As we age, it can become more challenging. But I'm appreciative of being able to do it right now, and I know what it's like to not have it, and to suffer the kind of mental crisis that comes with that. And so that
Hmm.
that makes me especially grateful to have it at the moment, but also to realize that that's not a given, and that if something happens again, I will be okay, and I'll have to be
Hmm.
okay. It'll be okay.
Yeah. Man, I wasn't expecting us to wax this philosophical this early in the hang, but I'm liking it.
Yeah.
um, I think it's really important to have it, to talk about these kind of things, because um, it's just, I think it's true for everyone, injury or not, recovering or not. It's
Yeah.
just we need to think about these things and talk about them.
Well,
But
I know that Dr. McGrail talked about this a lot. Because the Satchmo syndrome thing that happened to Louis Armstrong twice during his career, and he was
hmm.
able to rest and heal and scar up, and go on with his career and play, which is, like I said, what I did when I was 15.
Mm-hmm.
But Dr. McGrail always said, "Well, I wish I'd known him. I wish I'd been able to help him. I wish I'd known what I knew when he was alive." He just wanted to help as many people as possible because so many people have injuries in playing brass instruments, and in reality they're very, very small. I mean, especially compared
Mm-hmm.
to what a sprinter like a Usain Bolt pull his hamstring, but he can still come back and win the 100-yard dash in the Olympics. That's a huge muscle, and it's a
Sure.
huge muscle injury. Having a very, very tiny little tear to the muscle fibers somewhere in our face is nothing compared to that. But what Dr. McGrail found out is that, like any other muscle in the body, it can be rehabbed. But people didn't know that before, so small injuries would be seen as career ending. People would use terms like, "I lost my chops," "I blew out my chops," things like this, not really knowing what they're saying.
Sure.
They're just, something mysterious happened, and now I can't do what I used to do. So hopefully we're entering a better period where people realize that you can recover from most anything. I know there are
Mm-hmm.
some things from which you can't recover, like neurological conditions, and
Sure.
I've met people who have either had some type of dystonia, which is a neurological condition,
Right.
or a Bell's palsy or something like this, and you're not going to be able to rehab your way out of a condition that's not an injury, but instead is a
Mm-hmm.
neurological condition, right? But Dr. McGrail said to me, "You're going to be fine. Start practicing again." I was like, "What? What are you talking about?"
Yeah.
And now I find myself saying that to people all the time, because I know it's true. I know that
Mm-hmm.
any kind of muscle injury in the lip or the face can be healed. The physical therapy process is rebuilding strength and reestablishing range of motion. And I've been through physical therapy with my knee, with my shoulder, with skiing injuries.
Mm-hmm.
And so now I can relate this to my own experiences with sports injuries, and
Yeah.
and it's the same thing basically. Only the lip is much smaller, so it can be healed much faster. But you have to know what to do and how to do it, and then of course, and this is something you and I have talked about. The important thing with that is not only rehabilitating the injured muscle, but it's returning to play in a way that prevents further injury. Because with these
Yeah.
playing injuries, they happen because the lip is not in a position that's strong enough to do the work that it's being asked to do, especially under the pressure of mouthpiece pressure. So
Mm-hmm.
when most people take care of their chops, they're talking about limiting playing time, about not playing things that are too difficult for them, about resting to recover from tiredness. This is all some things. These are all things you have to do if you don't have proper embouchure technique. But if you
Mm-hmm.
do, you don't have to do any of those things, because the embouchure is protected from damage caused by mouthpiece pressure. So rather than reduce mouthpiece pressure, the answer to good embouchure technique is always to neutralize it rather than to reduce it. Oftentimes, these injuries happen when people are trying to reduce mouthpiece pressure.
But neutralizing it
Yes,
is what helps
right.
it
You have to
helps
play
prevent it.
in a way
Interesting.
that mouthpiece pressure doesn't cause damage.
Yeah, that makes sense. And that
Rather
actually,
than
oh,
rather
go
than
ahead. What are you?
babying yourself around the issue of mouthpiece pressure.
Sure.
That's
Yeah, yeah,
that's
yeah.
that's where most people get hurt.
Yeah. Gotcha. That makes sense. Um, and that actually provides a pretty good segue for us into the next thing I wanted to talk about with your experiences is your experiences now helping. I don't know how many trumpet players, or I don't know if you've delved into helping other brass musicians recover from their own injuries. And I'm just curious if like you had any experience helping trumpet players, rehabilitate before seeing Dr. McGrail and before your own experience and
No,
after, and if there had been any, like, no.
no.
So what has your experience been like, helping other trumpet players rehabilitate, since your injury and from a pedagogical, from a, you know,
Well, the physical therapy
methodical.
exercises that Dr. McGrail invented are very specific, and they're a little difficult to learn. And as a matter of fact, I wasn't doing them correctly after the first time I saw him, and I went back to see him after a few months, and he said there'd been no improvement.
Hmm.
You must not be doing the exercises correctly. Let's watch you do the exercises. And in fact, I wasn't doing them correctly. So to get the benefits of the exercises, you have to do them in a way that really does work the lip muscle and tire it out, so that it can rebuild. Just like when you go to the gym and you're doing curls, you have to get a burn in this muscle, So once I started doing it correctly, then it really started, going great. And I was able, sound was coming back. The lips were starting to vibrate together.
Yeah.
But since I did these exercises so long and so diligently, in the years following that, if anybody had trouble understanding the exercises, Dr. McGrail would recommend they call me for like a little tutorial on how to do the exercises. And especially since Skype and Zoom and all that, it's been much easier to do that
Sure.
with people. So I don't know how many people I've seen, but Clark, it's been a lot. It's been a lot.
Yeah.
And I would say I typically hear from 3 or 4 new people a month who are dealing with something, who end up coming to me. But it's funny. I don't want to sound negative when I describe the position I'm in. But it almost feels like with most of these people, they say something to me like, I've tried everything and I don't know what else to do, and you're the last resort. Like like
Hmm.
they've tried everybody
I called
else's
everyone in the
advice.
book.
They've called everyone in the book before they called me. It feels that way a lot of times, and the advice they get doesn't sound very helpful to me. You're not thinking about
Hmm.
your sound enough. Just relax your embouchure totally. Change your mouthpiece. Move your mouthpiece over to a different place. You're using too much tension. You need to take 6 months off. Okay, these are the things they're being told, and they fly in the face of everything I understand. So
Hmm.
you when you've hurt yourself playing, you're not going to play your way out of it. It becomes a medical issue, and you need to address it
Hmm.
medically with rehabilitation, and then you need to change the technique that hurt you. Otherwise, after you've had one of these injuries, you're more prone to re-injuring that same thing more easily. But if you can change the technique and develop firmness in the embouchure and firmness in the facial muscles that resists mouthpiece pressure, and learn to play in an
Hmm.
efficient way that way, yeah, I believe that anybody can go on with their playing and be happy and play well, if not better than before. I know in my case it was better than before.
Hmm.
You know.
Yeah, and that's hope for everybody going through injury.
Hmm. Yeah. So I think like the way Dr. McGrail said to me, you're going to be fine. When I hear people and I feel their pain and desperation, some cases, panic, depression, I love to be able to tell them, you're going to be fine. You know,
Hmm.
and then to see them come out the other end of it.
Yeah.
But yes, I have seen trombonists, I've seen French hornists, I've seen trumpet players. And sometimes I see people who don't have a lip injury. They just think they have a lip
Hmm.
injury, but it's something else. It's maybe it's a cut. You know,
Oh,
maybe it's a
yeah.
it's just they're swollen from playing improperly, but they haven't really hurt themselves. They're just beating themselves up and not recovering. But better safe than sorry. I'm glad that they want help, because I can see, you know, maybe you don't have an injury, a muscle injury, but you are hurting yourself, and something needs to be addressed, or you're heading for a
Right.
worse injury or something. So
Yeah.
yeah, to me it's all of a piece. It's all good understanding, good brass technique, and preventing injury go hand in hand.
Yeah. And that actually leads me. Oh, go ahead.
Well, I'm just saying that the thing I wanted to throw in, like I said, I don't want to be negative, but there there are many brass teachers not teaching embouchure and not dealing with the
Right.
subject of embouchure, but believing in a magical thinking system where if you just imagine the results strong enough, everything will be perfect and you won't need to know anything about
Hmm.
embouchure. And
Right.
the people who are being taught this way are almost always the people who are suffering these injuries.
Hmm. Yeah, I want to share a quick story with the audience that I just think is funny every time I think about it. When I first met with you several months ago on Zoom, I think you asked me this question like this. It was like, why do you think more and more trumpet players are getting injured, or more brass players, or something along those lines? And because you said like more trumpet players have been getting hurt in the last, I don't know how many years rather than before.
40
And
or
I kind
40
of
or
gave this
50.
40 or 50 years, so a big chunk of time.
Mm-hmm.
And I think I thought way too hard about it, because I gave this like, I don't know, minute long answer of how I think, we just push ourselves too hard or something like that, which I think is still true. But then you were just like, no, it's because it's poor teaching. And just, laid it down on the line. And so I want to kind of explore this with you, is like, where do you think this got started? And also, if it's more prevalent in just like the private teaching type of stuff, or if it's
It
more
seems
like
to
if
be
injury gets started on the public
it seems
section.
to be more prevalent in classical brass teaching today than in commercial brass teaching.
Hmm.
Back in the day, when as many people weren't getting injured, classical brass teachers talked more specifically about chops. But there's been a
Mm-hmm.
movement away from that, and it's based on things that are presented scientifically. In other words, your brain works better. Your brain and your body work better when you don't think about specific tasks, but you just focus on these goals. And it's not 100% true when it comes to brass playing. And I think that not all brass playing is the same. And I think that there's also been a
Mm-hmm.
movement to teach the same principles for tuba, trombone, trumpet, and French horn. And they all work extremely differently and need different approaches.
Yes.
And so, you rarely see a tuba player getting injured because the mouthpiece covers their entire lip and they're not creating a lot of pressure or tension in their face to play that instrument. But that has to change right away when you go to trombone. And then you need more when you go to trumpet, and you need more when you go to French horn. So as the diameter of the cups of these instruments narrows, more specific skill is required, more specific control, more deliberate understanding of what to do. That's as much as I want to say on that subject.
Okay. Yeah, it just when I first got injured and I started learning about um the ins and outs of embouchure, and even like to the extent of like why we do the exercises we do, that everybody's always, make sure you do your Clarks, make sure you do your, whatever. Um that there's a pedagogical reason behind those things. And it just I had never really explored that before in my own study. And so I just wanted to get your take. I wanted to get your take on, why. Well, first of all, how this is happening now, but more and more prevalently, but also,
Well, there's also an idea that an exercise will do something to you or for you, and it's simply not true. So that there
okay,
is no technical exercise you can do that will create a reaction in your body because your face does not have a memory. Only your brain has a memory. So it's not the exercise you do, it's how you do the exercise. So, in other words,
right,
you understanding why you're using it, how you're approaching it, and how to make it
hmm
better. And to me, like my trumpet teacher, Vince DiMartino, always taught me, you know, two things have to be present for you to get better. It has to be easier to do, and it has to sound better. So, if
hmm
it's easier to do and sounds worse, that's not good. That's not a good solution. If it's
right,
if it's if it sounds better but it's harder to do, that's not a good solution.
right,
So looking for easier ways to play Clark number 2, not just doing Clark number 2 over and over again and
exactly,
the same way and expecting a different result. That's literally the insanity definition.
right,
So I don't believe in routines at all. I believe in
hmm
practice. I believe in growth, progression. I don't believe in maintenance. I believe in progression.
hmm
So there is that's a part of the brass teaching too. Just give you an exercise and tell you to do it, but not tell you how to do it. And when you're not doing it easily,
or what?
the teacher doesn't say, "Well, it's because of this." They just say, "Well, think more about your sound." Or you're not using
Right,
enough air. And of course, to play the trumpet, airflow is the absolute last thing you ever want to use.
hmm
Airflow is the
hmm
enemy of trumpet playing. You can get away with a certain amount of it on trombone, and you absolutely have to have it
hmm
on tuba. But
right,
so the
yeah,
so the teaching in many cases is very much like the think system in the Music Man. So in the musical, the Music Man, the instrument salesman pretends to be a band director, but he doesn't
Mm-hmm.
actually know anything about music. He's not actually a musician, and the people buying the instruments want to learn how to play, and he tells them, "Don't worry, you use the think system. You know, if you just think the music's strong enough, when the time comes for the
Mm-hmm.
concert, it will come out. But you have to believe. You have to really believe this. You know, it's a think hard, the think system, and sure enough, at the end of the play, the band can kind of play. You know, and it's a miracle. But in real life, this doesn't work.
Right.
The best defense we have against stagnation as brass players is
Mm-hmm.
learning more and more and more about specifically how to control it, how to do everything we want to do, not wishing for it to happen, and believing that if we just keep doing it the same way over and over again, somehow it's going to get better. You know, so with all these things combined, to me, and I wrote an article that had this title. The article was "The Dark Ages of Brass Pedagogy." So, like
Oh yeah.
in the dark ages of history, you know, the event supposedly in legend that sparked the Dark Ages was the burning of the Alexandria library, where all knowledge was stored, right? And then all the knowledge was
Mm-hmm.
lost, and then hundreds of years went by before the Renaissance, when the age of discovery, people were rediscovering things they knew before but
Sure.
forgot. I think brass teachers knew a lot in the 19th century and early 20th century, and there's been so many generations of these brass players saying it's not important to know specifics, only think of the general. That
Mm-hmm.
this has now been accepted as the norm, and anything that sounds different from that sounds like some kind of heresy. But in fact, these people are exhibiting a kind of willful ignorance, and it's damaging to many students. If a student plays naturally and does everything right, they're lucky. Nothing needs to be
Mm-hmm.
addressed. All you have to talk about is musicality. But if a student
Mm-hmm.
can't do anything right and there's some obvious physical reason for it, but the teacher says your problem's in your head, that teacher is doing a great disservice to that student,
The service.
who could potentially have a great playing ability with the right instruction. You know, so sometimes these teachers succeed as players because they do everything right and they don't know what it is they're doing. So
Mm-hmm.
if they think that they don't need to know anything, well then you must not need to know anything either. You
Mm-hmm.
must just not be
And
thinking
that I
hard
think,
enough. The think system must not be in place. And
yeah,
you know,
we all need to channel everything.
I'm not naming names, but I myself studied with these people.
Mm-hmm. Well, I think that's probably the greatest gift that I've been given in my injury is learning the hows and the whys of the pedagogy, right? And it's made me want to become, more of a trumpet teacher than anything else. Is because there's that urgency to it
Mm-hmm.
now. That um, I was in my situation because I didn't know those things, and now that I do, I feel that you have that obligation to pass them along and help other people to be educated about their playing, about their instrument, but also um, how they can diagnose and help others do the same thing.
Mm-hmm.
It's just like that abundancy type of thing. So this may be kind of a broader question than I'm intending, but what do you think can be done to I guess in the music world, in the trumpet world at large, to kind of turn this whole thing around, this bus around of more and more kids and professionals hurting themselves?
Well, you're helping right now. So thank you for inviting me to be on your podcast. I am giving a lecture about recovery from injury and prevention of injury at the International Trumpet Guild Conference. I never before applied to present at the International Trumpet Guild Conference.
I will be there.
But I did apply and got accepted. So I'll in May I'm gonna give a talk about it. I don't know how well attended it'll be, but all I can do is talk about it. But it's helpful, at some point somebody has to say the emperor has no clothes. And that's not make me feel good, but it doesn't make me feel good to see so many people suffering.
Right. Yeah, I think that we can have these conversations all day and they need to be had, but we always are looking for those solutions, to be not only look for them, but also to become them. Mm-hmm. And that's and I appreciate you acknowledging me, because that was the whole reason why I decided to start this. I don't consider myself a content creator or podcaster in any sense of the word. I first and foremost want to be a trumpet player, but I really feel like the more that we have these conversations and they get in the right ears, we can, help people to, become more educated about about how to rectify this situation and turn this thing around. So thank you so much for your time today, Brad.
You're welcome.
I really have enjoyed our conversation and everything you've given me and taught me to help me get through my injury. It's really my hope that people take this, this conversation and run with it. If they're going to ITG, that, they go see your show or your presentation, I should say. Mm-hmm. My last question for you, and this is just kind of, there's going to be many people, trumpet players and not trumpet players, that are going through their own injury recoveries watching this episode. And I just was wondering if there is kind of like a universal principle of recovery or of just getting through it, or a message or advice or something that you would just share with them.
I think it's what we've talked about. It's recovery has two aspects. One is recover medically from the injury, which is the physical therapy exercises. Do physical therapy. You're not going to get better by resting or by playing. And the second is you can return to playing while you're doing the exercises, but you must return to playing in a way that is protective against injury. So you must understand how, if your technique caused the injury, you must understand how to change to come back successfully. Mm-hmm. So it's two things. It's two things.
Alrighty. Well, you heard the man. Now, alrighty. Well, so next time we'll have another interview with another musician who has gone through injury. Thanks for joining us. Mm-hmm. And until next time, just trust the process and keep going on. Thanks so much, Brad.
You're welcome.
Listening into our conversation today. I hope you got as much out of it as I did. To see a full bio for our guest today, see the show notes or go to our website at trusttheprocesspodcast.com. Make sure you share this with a musician you care about who's going through injury, or a music educator in your life, or anyone just trying to make it in life. If you have a suggestion for a guest or topic to cover, shoot me an email at trustprocesspodcast@gmail.com or send me a message on Facebook or Instagram. Before we go, I just want to give a heartfelt thank you and shout out to my team, Daniel Baldwin, who is my audio engineer, Kevin West, who does all music and sound effects for the show, and my sister Dana Lovell, who created the logo and promotional materials. We wouldn't have this show without them. So tune in next time for another episode of Trust the Process.